Opiates are very easily fallen into addiction because we don't see them as a problem. They're something that's prescribed to us by someone we trust.
It was an FHP trooper who found 2 bodies on the side of I-4 on New Year's Eve. Their bodies limp from a drug overdose.
You look at the folks on I-4, a perfect example of a married couple with children. Neither one has a criminal record, but they are addicted to these opioids.
Hello?
At the end of the day, some scumbag sells and sells and sells this poison, and eventually they die.
It's not a guarantee. In addiction, nothing is a guarantee.
Tonight, News 6 investigates the opioid epidemic, a crisis not just in this country, but for our community. Exhausting resources, threatening safety, destroying families by a quick fix that proves fatal for far too many. Thanks for joining us. I'm Matt Austin. Over the next hour, News 6 explores the lives of those faced with addiction. Cases like this couple. Their bodies found outside their car on the side of I-4 New Year's Eve. 3 small boys in the back seat of their car, unaware their parents were gone.
If we hadn't been able to take them in, they'd be orphans. So, I mean, they're orphans. They don't have any parents.
Tonight, News 6 returns to talk to those brothers as they try to rebuild what the word family means in a new home. But before we jump to life now, we have to start with how we got here. From doctors to dangerous drug deals. Investigator Lewis Bolden starts our special report with a glance back at the 90s.
OxyContin went on the market as a long-term painkiller in 1996. A year later, the company launched a campaign called I Got My Life Back. A doctor enthusiastically endorses OxyContin, and 6 patients talk about their pain stopping, all because of this powerful pill. The marketing caught the attention of doctors around the country and eventually patients who asked for it by name.
There's no question that our best, strongest pain medicines are the opioids.
North Carolina Dr. Alan Spanos made a convincing statement back in 1998.
They don't wear out, they go on working. They do not have serious medical side effects.
It sold doctors finally an answer to help patients get rid of pain.
And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
Around the same time, pain was put on equal status with blood pressure, heart rate, and temperature when measuring a person's health. Doctors were encouraged to ask patients about their pain level, and many felt compelled to aggressively treat it.
Physicians were actually penalized for not making patients 100% pain-free.
At the time, Dr. Parveen Khanna was a medical student. She is now a pain management specialist, but remembers the pressure to prescribe.
Patient became the judge. If you don't prescribe them or treat their pain the way they want to, you get bad reviews.
Dr. Sunil Joshi, the president of the Duval County Medical Society Foundation, says it wasn't just the marketing, but major studies that refuted what doctors had always known about opioids. They are addictive.
So then you start looking at all that and you feel that the drug is not habit-forming or addictive, so you feel like it's okay to prescribe it.
During this time, prescriptions exploded, going up 8 million in 1 year, including more for longer-term prescriptions like 30 or 90 days for acute pain.
I think that without question, we have to take some responsibility here because these medicines are coming by prescription, and we have to realize at some point that we're only treating pain for these patients and we should only be treating it for brief periods of time.
Just 3 years ago in 2014, the guidelines from the American College of Physicians changed. It now recommends that patients should physically see the doctor to get a refill instead of just calling the office. Doctors are also encouraged to address acute pain with shorter prescriptions and no refills.
You really need to be a little bit of an investigator, but also you do need to take patients at their word.
Dr. Justin Spooner at Beach's Laser Spine and Pain is also a psychiatrist. He believes doctors have the responsibility to be part of the solution, and that means being proactive.
And that's, again, where it comes down to physician training and education. Many physicians are well-meaning. We have a medication that makes you feel good. Why not give you more? And doctors are aware of the risks.
When prescribing opioids, Dr. Khanna uses a checklist to determine a person's risk for addiction. She also has them answer questions to rate their sleepiness and sign an agreement that they won't share or abuse these drugs. She says the responsibility falls on her to consider all of this when prescribing opioids.
it doesn't feel good. Sometimes you feel a little guilt at times that I should have recognized the problem.
Dr. Joshi says all doctors have to make the tough judgment calls. If not, the results can be deadly.
The physician needs to go to bed at night feeling like they did what's right for the patient. And ultimately, when physicians are looking at it that way, being altruistic for the patient, they will always do the right thing.
As for the I've Got My Life Back campaign, it was repeated 2 years later, and patients still raved about OxyContin. It wasn't until 15 years later in a separate documentary that at least 2 of those patients or family members said the drug was addictive and after many years of use actually ruined their lives. Matt?
Thank you, Lewis. And as we talk about this surge in pain prescriptions, Florida really the epicenter. And it did not go unnoticed. In 2010, the Drug Enforcement Administration found 90 of the top 100 physicians purchasing oxycodone were based right here in the Sunshine State. The following year, lawmakers cracked down. Those 90 doctors on the top 100 list plunged to 13. Over the next 2 years, the DEA proudly announced Florida did not have a single doctor on that list. At the time, it appeared promising. But like most things in life, it came with a catch. Supply and demand. The Volusia County Sheriff says pill mills closed, opening the door for drug dealers to feed customers a whole new way.
Young, 13 years old.
13, heroin. Wow.
It was put in front of me, and it was just like, here, do this.
About 16 when I started using seriously. I was prescribed pain medication from a doctor. Within a year, I was taking probably 10 to 15 a day. You're chasing that same high that you had the first time you used. So why would I spend $30 on a pill when I can spend $30 on heroin and get twice as high? The heroin was a way for me to get that initial high back, that first time high back that I hadn't been able to get since the first time I started using.
If you know something is good one way and you suspect it to be better another way, wouldn't you want to try that? And then you do that, and you say, well, look how much better it is this way. And then next thing you know, there ain't no going back to that.
You go to bed thinking about it, you wake up in the morning thinking about it. I've got to get the money somehow. I've got to call the dealer. Who knows when he's going to wake up? Who knows where I'm going to have to go to get it? But I've got to do all that dope sick. And dope sick, a lot of the times, especially when you're in the middle of the addiction, is like the flu on steroids.
So you got to the point where you were robbing and stealing?
Absolutely. Right, you know, I'd steal anything. Anything and everything from people that I loved, from people that, you know, gave me jobs. I mean, I didn't care about myself, so why am I going to care about anybody else?
I've had my life threatened multiple times, all in the name of just getting high.
If I all of a sudden wanted to get heroin, I would have no clue where to go.
Walk through town.
Is it that easy?
Yeah. I'm in the store one day and I hear a pill bottle in somebody's pocket in the store. So I look at him, Next thing you know, he's my new hookup. It's not a treasure hunt, it's there, it's around.
Do you have much experience with the fentanyl?
When my grandfather passed away, I found a bag full of fentanyl. I said, okay, well, let me put one here, here, and here, you know? Yeah. So here I am walking around with 4 of these things on me for a month. I would cut them open and eat the gel, shoot the gel, it didn't matter.
It is an incredibly powerful drug, so people are able to buy a little bit less, get just as high, but the problem is if they use the same amount that they were using with that heroin, they're gone, they're dead. That's what's so dangerous about the ones that are on, the stuff that's on the market now is no matter how strong you are or how tolerant you are to the opiate, it's still a guessing game. You don't know what's in it. There's no way of telling what's in it. And I've never met an honest drug dealer.
I would think, like just from a business standpoint, if you're selling somebody something and they're dying from it, that's not a very good business model.
Well, if you're shooting something in your arm and there's people dying from it, why are you still doing it?
Yeah.
Because you're addicted to doing it.
When I dealt it, I didn't care about who I was selling it to or what happened to them. It was, in my mind, it was their responsibility to handle it responsibly. A dead client isn't a good client, so we don't intentionally try to kill them. As the dealer perspective, we don't care if they die though.
By the time I was 27, that's when I realized I had a real problem.
Really? Okay.
Doing heroin in the bathroom at my buddy's funeral, who overdosed from heroin.
When you went through withdrawals, was it Basically cold turkey because you went to jail?
Yeah, put in handcuffs. You know, I shot heroin, and then 3 hours later I was put in handcuffs. I sat in prison for almost 18 months, and for 16 months I still wanted to get high. You know what I mean? So it still hadn't changed for me. The light bulb still hadn't gone off. I still wasn't ready for it.
For me, it was hitting rock bottom, losing my family, losing touch with everybody that I cared about, almost losing the girl that I'm with now, my fiance, losing my kids. It took all of that and going to jail for me to say, enough is enough. I'm not doing this anymore. I refuse to lose anything else in my life.
I was given hope that I could do it. You have to do it, and you have to do it for yourself and nobody else.
4 years
of sobriety.
Congratulations on that. That is amazing.
Thank you.
There's a life after addiction. There really is. For me, it was my faith. I decided that I was going to cling to my faith more than I was going to cling to the drug that I was on. A 12-step program, no matter where it be or what kind it is absolutely essential in my opinion. I wouldn't have been able to do it without that.
Well, you need to understand it. You need to ask questions and be involved in it. Go to meeting, go to an AA meeting or NA meeting or whatever. Yeah. Even though you don't have the problem, you know, that's my first advice to anybody. You know, well, my son's going through this. Well, then go to meetings so you can understand addiction. Don't bond him out. Let him sit there. Because you know what? He ain't gonna die in there. He's got a better chance of surviving in there than he does on the street. Listen, I was sitting in jail and my boss was gonna bomb me out. He wasn't signing for me, you know? So I said, well, call my mom, she'll sign. No, she didn't. Do what? I was, you know, and I was mad, you know, for about 16 months. And then I said, oh, thanks, appreciate it. You know, you saved my life, thank you.
Addicts are not worthless. They have trained themselves to do whatever it takes to get what they need. If you can put half of that motivation into something productive and positive for your life, you'll make it. It's not hopeless. It's not the end. There's always another chapter. Just make that chapter better than the rest of the book.
Kevin and Travis, two different stories, both in the same dangerous race for that next high. Now they're taking steps to overcome it, something not every addict gets the chance to do. Take Orange County. The medical examiner tells us from January to May of this year, they have had 30 heroin-related deaths, on pace with last year's numbers. Deaths as a result of fentanyl, though, are up, with 45 deaths in the first 5 months of 2017. Orange County had 68 fentanyl deaths for all of 2016. Fentanyl is 50 times more potent than heroin. 2 milligrams is all it takes to overdose. That's smaller than a penny. Anchor Lisa Bell joins us live in studio with how it's making these drugs even more dangerous.
Yeah, Matt, fentanyl is a synthetic opioid prescribed by doctors to treat chronic pain. Used illegally, it is dangerous to everyone. It can be absorbed through skin and inhaled if airborne. The smallest amount can be deadly, devastating families across the country.
Oh, she's a good girl.
Playing with her son's dog Java, seeing his talent framed on the walls of her home, Vicki King has constant reminders of who her son could have been.
Had an eye for the camera. I don't think he realized how good he was, and he loved it. But then when things started getting bad, that passion started to fizzle away.
Vicki says Jeff was a good kid. She never thought he would become addicted to opioids. 2 years after his death, she still wonders how he started down that path.
He had a snowboard injury, and he broke his arm, pulled off his rotator cuff, he dislocated his shoulder, had some major surgery done, and he was probably about 15 or 16 at that time. But I don't know if that's what triggered it.
As he finished high school, grades were slipping. Stories weren't adding up. But Vicki just thought her son was being a teenager. He went away to Wayne State University. Then she got a major wake-up call.
Found him in the emergency room at Beaumont. And he was there for an overdose. That just opened the door to all the demons. We found out all this stuff about the pills and hiding things and skipping classes, just everything. Everything started to fall into place.
Vicki and her family got her son into recovery, but it was short-lived.
You know, the last text I got from him the night before he died was, "Mom, I need $40 for food." And apparently it wasn't for food. So that's how it all ended.
Her son overdosed on heroin laced with fentanyl. He was just 20 years old.
I don't know if I've ever seen anything in my career that's more significant than the fentanyl.
Timothy Planson is on the front lines of the opioid battle, overseeing the Drug Enforcement Agency's efforts to combat the crisis in Michigan, Ohio, and Kentucky. He says heroin laced with fentanyl is smuggled in from Mexico, but fentanyl is also being ordered online and shipped in from China.
It's dangerous for everybody involved.
We know heroin is a big problem. A report by the National Center for Health Statistics showed heroin became the #1 overdose killer in 2014. It also showed overdose deaths from fentanyl, a drug 50 times more potent than heroin, doubled from 2013 to 2014, though it's unclear if the spike is partially due to coroners being asked to list specific drugs as a cause of death.
Fentanyl, about the equivalent of about 2, 3, 4 grains of salt could kill you. It's not just mixed with heroin anymore.
Some people are taking cocaine laced with fentanyl because they think it's less addictive. It's not. Others are just taking fentanyl. Agents are seeing the drug on the streets as liquids, powders, and pills. The chemical stuff, or pure fire, are names the DEA says people are using to get it.
It's extremely profitable, which is even scarier because you have a lot less, which is a lot easier to smuggle, and it's extremely profitable, far more profitable than even heroin.
Profitable and potent, a deadly combination, says Dr. Frank McGeorge.
We're not talking about pharmaceutical grade drugs here. We're talking about drugs that are made by some random foreign, drug maker or even domestic drug maker. They don't have a lot of quality control in all of this, and they're cutting it on their kitchen table. So there's nothing good about this at all.
Vicky now volunteers for Hope Not Handcuffs, a program that helps addicts get into recovery. She doesn't want any parent to go through what she has.
Don't be the mom that I was, and don't say, oh, my kid would never, ever, ever do that. Always be on the alert. Always, always be on the alert. Never say that, because you just never know. You can hear my story, and you can hear other stories from other parents just like me. They'll say the same thing. Don't ever say, not my kid.
And the other problem with fentanyl, it is a synthetic opioid, and there are several different types. Carfentanil is just one example. It is an elephant tranquilizer that is 100 times more potent than fentanyl, and it's out there on the streets right now.
Amazing that you can overdose just by touching the stuff. Lisa Bell, thank you. As Lisa just said in her story, it is getting on the streets any way it can. Coming up, what's being done to stop it? News 6 investigator Mike Holfeld gives us an exclusive look at border security at Port Canaveral. Also, local agencies with a new approach. Who's funding their fight for the anti-overdose drug Narcan? Plus,
they looked fairly normal and everything, but I mean the part about Heather and Daniel is the chaos it created.
His daughter died of an overdose. He shares his new normal, raising her 3 young boys. First, though, we head out of the studio to the News 6 phone bank. Anchor Kirsten O'Connor standing by with addiction experts.
And right now, our hotline is open. Addiction and recovery specialists with the treatment facility New Season are on standby. They have been all day. The number is on your screen, 888-436-6665. We want to talk with Andrew LaFontaine, who is with New Season right now. You've been here all day. We appreciate all of those phone calls that you've been answering. What are some of the questions people have?
We've had family members call and ask questions of where to get treatment, the cost of treatment, the different options of treatment there is for their loved ones, and various questions of that nature.
I'm sure cost is a big question that you guys can give a lot of different answers about.
Yes, some people were wondering, if I can't afford treatment, what are the options? And if that person meets a pay scale below poverty, maybe they qualify for Medicaid, that treatment facility can bill Medicaid, or they can pay a sliding fee.
And Andrew, I've been doing a lot of these interviews that are part of this special. A lot of these families are feeling like, it's not me, I'm not the one who has the problem, but you were telling me they can be the first step.
They absolutely can be the first step. They are they can be the one responsible for gathering as much as resources and answers that they can to initiate that person making a choice to get into treatment. So it's important that they call our hotline and get as much as resources that we can offer them to start that process.
Wonderful. Thank you, Andrew LaFontaine with New Season. And the phone line is open until 11:30 p.m. The number again, 888-436-6665. If you don't want to dial in, grab your smartphone and head to clickorlando.com/opioidnation. Find our investigative stories and see the impact this epidemic is having on our local counties. Plus, you can use our interactive tool to explore the effects opioids have on the body. Again, that's at clickorlando.com/opioidnation.
So now that we've touched on the genesis of the crisis, we move forward to those fighting against it. It's a constant battle. Tonight we found out not everyone on the front lines needs a badge. Kirsten O'Connor explains.
Hi, sweetheart. Hi, darling. Hi, precious.
For Pat Jordan, cuddling isn't just an act of kindness.
You just let him know it's going to be okay.
It's a calling. Pat has 6 grandchildren and 9 great-grandchildren, but the babies most people see in her arms aren't hers.
It's very emotional, and I cry a lot up here.
She says she cries because these babies inside the neonatal intensive care unit at Winnie Palmer Hospital are born with a condition the otherwise healthy newborns never had the chance to fight, caused by opioid addiction. Dr. Douglas Hardy treats about 150 babies a year born with neonatal abstinence syndrome.
Whether it's heroin, whether it's some of the other opioid drugs, the mom system absorbs the opioids and then it gets into the babies, and the babies then have to go through what's very similar to a withdrawal.
Oftentimes, NICU volunteers spend the first critical hours of the infant's life keeping them calm, while their mothers can't be there.
It's very, very difficult because, are very hard to take care of because they're extremely needy, and we just try to hold them tight and cuddle them and let them try to get over it.
They're very irritable, they're very uncomfortable, they don't socialize well, they don't like loud music, they don't like bright lights. Just being held by a volunteer is a tremendous improvement. It keeps the babies calm. If we can keep the babies calm, then we don't have to use drugs.
Jennifer Patterson has been working with families dealing with drug abuse for nearly 2 decades.
We have a lot of newborns who are born addicted and have to go through those withdrawals.
In some places, they may be occupying 40% of the NICU beds.
But it's not just the babies that addiction has a devastating effect on.
A lot of our parents have a lot of children. They may have 2 or 3, and the siblings could be older. And so it's affected them in school. I mean, it affects the families because of homelessness. They tend to be a little bit more transient because, the parents are struggling to maintain employment. It's a ripple effect through the whole family.
Children sometimes do have to be removed from their parents, and they do need a safe place to stay while the parents overcome their addiction.
The most recent data from the U.S. Department of Health and Human Services show as the opioid crisis gets worse, more and more kids are being placed in foster care. Nationally, the numbers jumped 8% between 2012 and 2015. Generations United estimates more than 2.5 million children now live with relatives or family friends instead of their parents. Substance abuse was the reason for the removal of more than 32% of children in 2015, and experts say that number could be underestimating the problem, depending on how local officials fill out forms.
While children are separated from their parents, case managers say they try to have the kids visit with their parents as much as possible.
Make sure that, they know that mom and dad are trying really hard and that mom and dad love them a lot.
Patterson says the addiction cycle she sees is hard to break out of. And the worst case is when the cycle comes full circle.
I do unfortunately see some of my children that were children once have become parents and also are struggling with the same issue.
And best case, parents find employment, housing, and freedom from their addiction. These Florida families are reunited.
The feeling that you get, having worked with that family and seeing them work so hard and being successful it's magic. Like, there's nothing in the world to describe it because, it's the best thing for a kid. is to be with their mom and dad.
Now, children of the opioid crisis are not always that young. In this next case, the roles reverse. A daughter in too deep in the world of drugs, her mom desperately fighting nearly a decade to get her clean. Tonight, it's no longer about prevention. For this parent, it's preparing for her child's next bad batch. Nadine Yanis shares her story.
I just ripped her out. We laid her here. She flatlined.
Her lips blue as ice, her breath silent, and her pulse gone. A 23-year-old woman we'll call Susie was dead until a deputy brought her back to life in a movie-like moment.
Well, I don't know if anybody's seen the movie Pulp Fiction, but it was pretty much like that.
Showing the life-saving efforts of the overdose reversal drug naloxone, also known as Narcan.
I knew I had the tools to help this person, and I didn't have to watch someone perish.
It was a moment Susie's mom is thankful for today.
Narcan saved her life.
Knowing her daughter has overdosed before, but never seeing it for herself.
When you saw her OD and then be brought back to Narcan, what was your reaction to that?
And it was startling, and it was numbing, and it was scary, especially when she sat right up.
But it wasn't the first time, and it wouldn't be the last.
Will you accept treatment?
Yes.
It's a battle this mother has struggled with Susie for nearly a decade. In 2012, she went on Anderson Cooper's talk show with Susie and her sister trying even then to break their addictions.
What's it like for you to hear that?
I'm elated, and I really hope that they grab hold.
But Susie never followed through with rehab and is still addicted to heroin today. Cooper even says 8 days after this overdose, Susie OD'd again, and once again, Narcan saved her life.
She wants to do good, and she wants to be an active member of society. She just wants to be normal, and there's always this monkey on her back.
Both times Susie was saved, the Narcan was supplied through government resources. Orange County officials gave 900 units of Narcan to law enforcement last year. The price tag, about $25,000. But it's already credited with saving more than 120 lives. According to the CDC, government agencies have been stocking up on Narcan for the last 2 decades, but have needed to use it much more in recent years. The latest study from 2015 shows the number of organizations providing Narcan increased by 183%, saving more than 26,000 lives. And the epidemic has only gotten worse since that study. In Orange County alone, overdoses have gone up 71% just in the last year. That's why CDC officials want more than just police officers getting Narcan in their hands. They want users and loved ones to get it too.
And what you might not even know, that in 41 states, including right here in Florida, you could just walk up to a pharmacist and get Narcan yourself. The pharmacist will go in the back and get it. You don't need a prescription. You won't get in trouble. And in some cases, your insurance might even cover it.
It's relatively cheap. The intramuscular injection is about $45. The nasal spray is about $110. CVS Health wanted to provide naloxone to more patients, be able to save lives. We want to give those patients a second chance at getting the recovery they need.
But there are critics out there who say Narcan is not a savior. Instead, it's an enabler. These are just some of the comments posted on social media after Susie's overdose. Let her overdose. We should not be spending taxpayer money and resources reviving these people. Only problem is, she'll do it again tomorrow. We took these comments to the director of Sunrise Detox Center, Dennis Kaleda.
I'd say it's just a little ignorance.
Kaleda says addiction equals disease.
When you're waking up every day and you need something to function, that's an addiction and it's a disease.
Adding these addicts need help.
So no matter if there's Narcan available or not, they're going to push the limits of it because that's what their disease tells them that they need to do. If your son or daughter overdosed, would you want them to have something easily accessible to bring them back to life, or would you just want them to die?
For this mom, the answer is no. She now has Narcan at home for her daughter.
You just try to have a glimmer of hope, but it's diminishing. It's up to her.
So it's not just Orange County. The anti-overdose drug is getting in more hands of law enforcement, the most recent being the Volusia County Sheriff's Office. With the help of a grant, they started deploying deputies with Narcan in June. Their deputies have used it a total of 10 times. In each of those cases, the patient survived. Neighboring Seminole is also equipped with Narcan. The Sheriff's Office tells us they started issuing it to all of their patrol deputies last November. The unit's costing $75 for a 2-pack. They've spent a little more than $17,000 on it. From November to August 22nd, they have used it 32 times. All but 2 were successful. To talk more about this fight against opioids, I'm joined live in studio by Special Agent Danny Banks with the Florida Department of Law Enforcement. Danny, thank you so much for joining us tonight.
Thank you for having me.
Appreciate
Great
it.
story.
It is our pleasure. Well, Governor Rick Scott, he declared this a public health emergency in May. I'm curious, has that changed the fight for us here in Florida?
Well, it's changed the fight not just for law enforcement, but for all of public safety. This is probably the top public safety issue we have in Central Florida right now. We are at a crisis situation with more lives being cost of our citizens and visitors right now than any other type of event we're having.
Top public safety.
It's a top public safety issue to us right now.
Oh, that is crazy. I know you're a part of the heroin task force.
Absolutely.
In Orange County. Let's talk about the epidemic in our community. What have you seen over the past few years? How has this evolved?
Well, we've seen it transition from the late 90s, back in 98, all the way to 2000s. We had a heroin epidemic then. That grew and changed, and the opioid epidemic has continued to change and just morphs into another presence. We've gone to prescription pills. We fought that battle in the late 2000s and 2010, the prescription pill epidemic. Now we're back to heroin and seeing these new fentanyl. We see fentanyl, carfentanil, and the other things you've mentioned already tonight. It's our top battle in the drug epidemic in Central Florida right now, and it's one that's killing more people in Central Florida than any other thing.
Yeah, and a lot of people look at this crisis, unfortunately, it's one of the big problems, that it does not affect them. For those people who are watching tonight, what would you say?
Yeah, you know, there's not a single family in Central Florida that is likely not affected by this. This epidemic does not have a social or an economic class that it targets. It doesn't have a difference of race, of gender, of sex. It goes after everyone. So any family, my own family, have all been affected by this epidemic, and that's why we all have to stress its importance.
It does not discriminate.
It does not at all.
Special Agent Danny Banks, thank you so much for joining us tonight. We really appreciate it.
Yes, sir.
And it's not just getting drugs off the streets, but making sure they don't get here in the first place. Tonight, News 6 takes you behind the scenes of border security. Investigator Mike Holfeld has this exclusive report.
The calm setting of Port Canaveral's sun-drenched landscape has become the backdrop for opioids and other illegal drugs, tucked away in cruise ship passenger bags, hidden in belt buckles, and eventually, Brevard County Sheriff's evidence bags.
They're developing these pills to look a little more like candy.
The drugs intercepted by K-9 deputies earlier this year are custom designed, marked and color-coded, essentially dealer trademarks, all far more potent than they appear.
This was a LSD, and of course it's, on a paper blotter.
The LSD is actually stamped with pictures of McDonald's hamburger characters. Other confiscated drugs include opioids, fentanyl, ecstasy, and MDMA. As you can see, it looks a lot like Pepto-Bismol, but typically it's a blend of heroin, LSD, and cocaine.
Same drug, but their name brand, like their brand.
Deputies say those brands were confiscated in January from passengers ready to board a party cruise dubbed Holy Ship. In this video posted on the company's Facebook site, you see the theme, Respect the Ship. Still, passengers tested the system and lost.
Come on, buddy.
In January, the Brevard County Sheriff's Office, led by Sheriff Wayne Ivey, brought in trained canine dogs to the port. On average, 6,000 passengers will board a ship with 2 bags each. Any of them, detectives say, could contain opioids or other illegal drugs. In this demonstration for News 6, you can see how a dog is trained to pick up the scent of drugs. Black tar heroin has been planted in one of the bags for this test. Now watch. In less than 20 seconds, the canine named Jake finds the drugs. To the dog, it's all a game.
Good boy. When we come in here, it's playtime. They know when they find what we train them to find, they get their ball.
And you saw how fast the dog was able to find this. compared to you trying to hand search everything. And then on top of that, you know, it's well hidden.
That brings us back to port security and the potential ship-to-shore drug trail. News 6 was given rare access to Port Canaveral's passenger baggage drop-off, as well as the port's electronic surveillance center, each screen monitoring key points on the perimeter. As bags are rolled in for delivery aboard the ship, a K-9 team executes a random check of passenger baggage.
Brevard County K-9 officers tell me they could spend a full day here, go baggage row by row, and not get a single hit. We were here less than 5 minutes. Watch this.
Let's find it.
Our K-9, Jake, is about to pick up a drug scent. Remember, when he sits in front of an item, he smells drugs. This time, the deputies pull the two carriers apart to make sure it's not a false reaction. Watch. Same result. When they check the second carrier, the dog walks around and away and back to the other bags. Now that bag becomes part of an instant investigation. Deputies tell me this illustrates how important these K-9 teams are.
In this big pile of bags, you'd never know which bag to pull. You know, he's telling us, okay, there's something here.
So in theory, somebody tried to slip something through.
Could be. That's what the dog is telling us.
Does this happen a lot? People try to slip through?
It's a hit or miss. You never know.
That was Mike Holfeld for us. Fighting the epidemic and finding ways to fix it. Can we change the way we handle pain? Tonight, the alternative treatment. Groundbreaking research requiring the help of addicts to get results. Then,
if necessary, we will build more than one recovery high school down the road.
Inside a first-of-its-kind high school for addicted teens, the student population preparing to grow. Then the heartbreaking discovery, 3 brothers found on I-4 after their parents overdosed. Where are they now? We're back in seconds.
I tell everybody, you may not get that second chance. Doing this stuff is playing equivalent to Russian roulette. You know what I mean? You're putting the gun in your hand and pulling the trigger.
News 6 is committed to getting results for people dealing with opioid addiction and recovery. Specialists with New Season are here to take calls about the epidemic. We have been getting calls all day long from people, family members asking what they can do to help, and sometimes they're the first step. The number is 888-436-6665. The hotline is open until 11:30. And if you don't want to call, we do have other outlets. We're using Facebook Live to allow you to ask us questions, and you can join the conversation at facebook.com/news6.
Taking you back to the 80s and 90s, okay? It was a perfect storm where everybody was guilty. Everybody had their hand in the cookie jar. What we've done literally is done the largest experiment in human history on 300 million people. And we've been doing it for 30 years. And now we have data. And the data is not very pretty.
Tonight, from fighting the epidemic to finding a solution. In 2015, the CDC says there were enough opioids prescribed to medicate every American around the clock for 3 weeks straight. Closer to home, the CDC broke it down by county. In Seminole, there were 55 opioid prescriptions for every 100 people. In Brevard County, that number was higher, 92. Tonight, the question, does it start, and how do we address and control pain? Anchor Ginger Gadsden examines alternative treatments.
Hey, come on in. I'm Marcia. What's your name?
Tucked away in a small room at the University of Houston is a cave.
Is that here?
Inside this cave, researchers are using virtual reality to help addicts kick their heroin addiction.
I believe that it is the first in the nation around to be able to investigate the use of this technology around heroin and opiates.
Mickey Washburn oversees day-to-day operations of the lab.
This is very cutting edge.
Addicts strap on a virtual reality headset and navigate through a house party scenario. 8 cameras project life-size 3D images on the walls of the room. Details like an open pizza box to a spoon and syringe on a table are meant to enhance sensations and trigger a heroin craving.
In this controlled environment, we're teaching them coping skills.
If we try to do this in the real world, going out into the street with them so that they can see the house where they last injected, or the people that sell to them, or the people that inject with them,
that poses dangers.
Luis Torres is the director of the center. This virtual reality would not replace traditional therapy, it would be in addition to it.
If we can have multiple tools to help people who are trying to combat their addiction, we're giving them a better chance of success.
Inside the small hospital, more potential breakthroughs.
What I've seen so far has been amazing.
Dr. Harold Minkowitz is leading a clinical trial. How to prevent people from becoming addicted to opioids in the first place.
6% of people after minor or major surgery are still using opioids 3 months out. So it's a problem.
In fact, opioid addiction can set in as little as 7 days. So Dr. Minkowitz is testing out a potential miracle solution in the operating room during extreme surgeries like a tummy tuck.
During the surgery, patients are given opioids during the surgery because you're correct, it's a very traumatic and it's a very large operation.
But after the surgery ends, the special goo is placed over the wound. Then the wound is closed up. Then the patient goes off to the recovery room.
The opioid use ends once the patient leaves the operating room.
Mary Hernandez had her tummy tuck with the goo in December, right before Christmas.
Post-op surgery after that, when we went home, I didn't actually need any medication. It actually was really good. There was minimal pain.
This is a double-blind study. There is a placebo group and a regular group. Mary and Dr. Minkowitz don't know who is in which group. But Minkowitz feels so far the results speak for themselves.
When I first saw her and some of the other patients in the study, after they were in the recovery room, I thought maybe they did the wrong surgery. I thought they're just too comfortable. They could have all been placebo, but their response was so dramatic that it was pretty amazing.
Trials and research can take years to prove effective.
Good morning, class.
So, for a more immediate remedy, Dr. Rosalind Morales is training the next generation of nurse practitioners.
Unfortunately, addiction is not specific to any certain individual.
Students are learning the standard CDC guidelines, but Morales goes above and beyond that.
I tell my nurse practitioners that how they prescribe makes a difference how the patient will feel, but you can also prescribe and make the patient worse.
The philosophy, take care of the patient as a whole.
Not only their physical needs, but their mental, psychological, and spiritual needs.
If a patient requires pain management, we want to do something on a short-term basis that has a lower risk of abuse. We refer out for physical therapy, massage, acupuncture, those sorts of things.
Now, after addressing the pain, it's also important to address the mindset. Dr. Warren Bickel, leading the nation in studying characteristics of who's addicted to substances. His research shows how you see your future plays a role in addiction. He calls your outlook on life future time perspective. Dr. Bickel's findings reveal the average person thinks of their future in terms of about the next 5 years. But addicts on average only think of the next 9 days. The study began after a conversation decades ago with a man excited to try a deadly batch of heroin.
He said, haven't you been reading the paper? There's such pure heroin on the streets of Baltimore that people are overdosing. I had to try some. So when I heard that, I said, unbelievable.
Dr. Bickel works at Virginia Tech Carillon Research Institute. When asked how to solve this growing problem, he says, we're not going to arrest our way out of it. He says the first step among many is adding more treatment facilities. Tonight, anchor Lisa Bell shows us how one of those new facilities is catering to the classroom.
Every day at Archway is a beautiful mixture of traditional education.
The classrooms at Archway Academy look like your typical small school.
The kids are taking math and science and English and history, and they're taking the PSAT.
But it's tucked away inside a church, in the shadows of the medical center. And the school is also centered on the principles of recovery.
When we started asking kids, where do you have the easiest access to drugs? They would tell us school. So we decided in 2004 that maybe what Houston needed was a school that was devoted specifically to students with drug and alcohol issues.
It's a school for kids who've already been to rehab for things like opioid and other drug addictions and need a safe place to learn.
We were created by a group of parents who had lost their children to addiction.
The program at Archway was once one of a handful nationwide. Now it's become a model copied across the country.
We have folks from every area of the country that come here and spend time with us to learn what a recovery school is and to take back what they've learned into their community.
They've mentored at least 15 schools just over the last 5 years. The day starts off with a morning check-in process. Students can talk about anything on their minds, from a fight with their parents to a big urge to use drugs.
And that's where the recovery staff we're able to kind of put our finger on the pulse of the community. How's everyone doing?
Then the traditional classes get underway.
But every student knows that from 8 o'clock to 3 o'clock, they have recovery support people here just waiting to give them whatever it is that they need. So if they're sitting in a math class and they start having really high anxiety or they start feeling extremely irritable, they know that their teacher can call down to our support office and we'll have a recovery coach come to them in their class. Part of the magic of Archway Academy is that half of our staff are in personal recovery from substance use disorders, including myself.
Archway is a private program, one of about 40 in the nation. But as for public recovery high schools, there are only 8 nationwide. This year, the first public program opens its doors in Harris County near Houston, Texas.
We understand that it's going to be pretty much unprecedented in Harris County moving in this direction with a current epidemic that's going on right now.
James Colbert is the superintendent of the Harris County Department of Education. This brand new recovery school will be open to any high school student in Harris County free of charge.
This school is not a rehabilitation high school. We will have expected our students to go through some formal rehabilitation process. Our goal is not to send them back to the high school for which their addiction could have started, but in other words, they can come to our high school to do the recovery process.
It's a 20,000 square foot facility currently being renovated from an old school.
We're going to have a $250,000 culinary arts facility. Then we're going to have almost a gazebo with an oriental garden in the back, ropes course.
Students can request to attend this program directly through their school district. Schools like this rarely have more than 100 kids.
We really want to get our feet on solid ground, so we will start our enrollment with just 30 students. The second year, we'll look at doubling that to 60, and then the third year, perhaps 90. So if necessary, we will build more than one recovery high school down the road.
Back at Archway, Sasha agrees recovery high schools are vital for children to break the addiction cycle.
The opioid crisis is hitting every family of every color, of every socioeconomic status. And I think that's why people are so afraid.
Now, as for recovery schools in Florida, we found one in Jacksonville. It is called River Oak Center and opened last fall. We contacted school districts in Central Florida to find out their programs to help addicts. See their responses on clickorlando.com/opioidnation. Matt.
Lisa, thank you. When we come back, the faces of addiction and the lives of those it affects. The 3 brothers dealing with the pain of losing their parents to an overdose. Months later, their recovery. Next.
There's help. There's always help. You're not far. If you're still breathing and you're still walking, it's not too late. You can get help. You don't have to give up. You're not worthless.
In my head, I believed for so long that I couldn't do it. But you can do it. You know, you can do it.
News 6 is helping to get results. I'm standing by right now with addiction specialists with New Season. They have clinics across Central Florida to help with recovery. People have been calling in on this hotline all day to ask them questions. A lot of parents calling in to ask about their daughters, sons, family members asking about their nieces and nephews. They have questions about cost for treatment. They have questions about the different types of treatment that people can get, and some addicts themselves are calling us today. You can too. The number is on your screen. It's 888-436-6665. The hotline will be open until 11:30 p.m. These are trained professionals who are here to answer your questions, and we know that it's affecting so many of you out there. If you don't feel comfortable calling or you just don't want to at this time, head over to clickorlando.com. There we have posted local investigations into the opioid epidemic, as well as ways that you can find help when you're ready. All of that and more on clickorlando.com/opioidnation.
It can happen to anybody at all. I've met people, kids who've grown up in church, had families that loved them, didn't have a single addict in their family, and they're just as bad off or worse than I was. And if you are one of those people that are sitting there thinking, oh, I've never seen any, addiction has never affected me, you need to take a closer look.
Now listen, this is a tough topic, often kept a secret, but there is no hiding this nationwide crisis. Too big to tackle as a whole, but we can start at home. If not for the health of the community, maybe from the heart, for kids like these 3 boys. They didn't know New Year's Eve would be the last time they saw their parents alive. Kirsten O'Connor shows us their life after loss.
It's New Year's Eve. A stalled car, hazards flashing.
Eastbound I-4 124 was now advised, and there's 2 adults laying outside the vehicle asleep and 3 babies inside the vehicle.
3 crying boys lifted from the back seat. Mike Belial still can't believe those kids are his grandsons, and the 2 parents slumped outside the car, his daughter and son-in-law.
They actually were druggies, but it's probably not what you typically think of as a drug addict. It looked fairly normal and everything, but I mean, the part about Heather and Daniel is the chaos it created.
Heather and Daniel Kelsey were married in 2010, and soon enough were proud parents of 3 boys, Joey, Aiden, and baby Nicholas. But Mike says problems seemed to follow his daughter, and he worried about his grandsons.
I mean, I made the statement to her, you and Daniel have got to start taking care of these kids. You're feeding them, but you're starving them to death. You're feeding them all junk.
In 2016, the Kelseys moved into Mike and his wife Lynn's home in Quincy, Florida.
I knew that both of them were withdrawing from something. The only thing I didn't know was drug of choice. And that month they were living by themselves, I'd actually said, you know what, they've done it. They've made it.
They spent Christmas at the Kelseys' new home. But days later, as the family gathered at Mike's brother's home in Gotha, they got the call.
The social services people called us on Saturday, and what are we going to, everybody's talking about you taking it, what are we going to do? And I said, I'm 58, I got to think about this, I don't really know if we're able to do this or not. And Sunday morning, I called them and said, yeah, we're going to take all of them. It takes a little bit for it to sink in. And then it's like, yeah, I got to do this. There's not a choice here.
A choice Mike admits no one ever prepares for.
There's more people out there like Lynn and I than everybody'd like to think. There's a lot of grandparents, older grandparents, actually older than us, that are raising these same kind of kids. So, I mean, they're orphans. They don't have any parents.
It was months before autopsy reports were released. Fentanyl, like so many other deaths, was to blame for the Kelseys' overdoses.
All right.
8 months later, 5-year-old Joey, 2-year-old Aiden, and baby Nicholas are still living with their grandparents. Lynn says their recovery has been a journey.
Well, when they first got here, they had something called night terrors. So it's not like anything sparked it, but he would say, "You're killing my mom, you're killing my mom." And he just was talking in his sleep, and he would say, "I see your eyes, I see your eyes. I'm so sorry, it's all my fault, it's all my fault." And for the longest time, he'd always say, "It's all my fault." Everything was all his fault. And so again, it was just trying to figure out, what they seen. But maybe since Heather was found slid down against the van, that maybe when she was, I don't know, convulsing or whatever she was doing, that Daniel might have been trying to shake her or whatever, and Joey's car seat was there to where he could see it, and maybe thought, "You're killing my mom," and watching her go down. And then maybe Daniel looked at him and realized what he just saw, and could have been through the window saying, "Look at my eyes," trying to get his attention, and saying, "It's all my fault, I'm so sorry," I mean, we only can speculate.
Happy birthday, dear Joey. Happy birthday to you.
They've started calling us Mommy and Daddy.
Mike tells us by the time the youngest of his grandsons is 18, he will be 75. He still hasn't forgiven his daughter for her choice that forever changed his life. but he won't let his grandsons forget their parents.
I want the people that are doing heroin, fentanyl, crack cocaine, even alcohol, all the stuff they're doing, I want them to see exactly what they're doing to their family, particularly the children, but their entire family. It's total chaos and destruction. This is not the way anybody wants to get their grandkids or their nieces, nephews. This is not how it works. Their parents are never going to get them back. They're gone. And people need to quit being nice about it, and they need to start saying, you're a drug addict, you need to get some help.
I think they've blossomed and come a long way, and I think that they just have so much more to do and to grow with, and they're just going to be awesome little beings.
You can do it, Swing. And they absolutely are.
They're adorable.
I spent almost a whole day with that family, and I know a lot of us were waiting for that update to see how those 3 boys were doing after seeing that dash cam video in June. It was just scary, and a lot of parents were asking us what happened to those boys. And they are doing so well. But I have to say, and I told you this earlier, Matt, going into that house and seeing that beautiful family, it could have been my house. It could have been my mom's house, my niece.
Could have been any of ours.
Any ours.
You look at the pictures, you just would never guess. Thank you so much for joining us for this News 6 special report, a report that cannot and will not stop here. Our initiative and push for results will continue in the weeks and years to come. In the meantime, our phone bank will stay open until 11:30 p.m. You can talk to specialists with New Season Recovery Center right now. Don't hesitate. Call that number if you need it, 888-436-6665. And of course, you can find help, our investigations and more at clickorlando.com/opioidnation.